made it without you.
Yeah.
In fact, Ohio would have lost it all. But now we see that you were there for me. Never would have made it without community health workers. Never, ever would have made it. You need to understand that I'm stronger. I'm wiser. I'm better. I'm so much better. I thought I would have lost it all. But you were there for me. You reached out to me. You made a difference for me. You interceded. You spoke up. You found a way out of no way when all was lost and the world shut down. It was community health workers that were still around, making porch drop-offs, texting and FaceTiming to make a difference. You need to understand that you matter, your voice matters, your vote matters. And today is your opportunity to be heard. You have the proverbial return on investment that everybody is seeking. You are the one thing that we need in this state to ensure that individuals who have chronic diseases, individuals who are high risk and pregnant, individuals who simply are coming out of institutions to be reconnected, young people who need a way to college, anybody. In fact, I believe a community health worker would improve my family reunion. What isn't better with care coordination? And so you need to understand that it is a privilege and an honor to stand before you. We cannot, nor would I, take credit for the difference you have made. You are truly what we call the difference. You need to wake up in the morning recognizing the power that you have. I want you to take this advocacy day as a day to be heard, not a day to be denied. It's a day to say, yes, I want a livable wage. Yes, I want benefits. Yes, I want to be heard and respected within other institutions of service. Yes, I am a part of the team. Yes, I am the connection you've never, ever had and can barely get. Yes, I matter. Your voice matters. Your vote matters. You matter. Give yourselves a hand. So I'm going to try to get to this PowerPoint. Okay, so clearly you all know I did not pass. Okay. You know this doesn't mean anything to me, right? Because you know I don't need a PowerPoint. I don't need a PowerPoint or a guided speech. I need you to hear me clearly. I need you to get your family members who see the sacrifices that you make. I need you to get the community members who know what a difference you've made in their lives. I need you to get them to speak about your value and about your work. Now, we do well at the state calculating. Dr. Ayez is right there. He can calculate to the penny the return on investment based on the interventions with individuals who are diabetic and are emergency room frequent flyers. And the ability for a community health worker to reconnect that individual, or and sometimes connect that individual to a primary care physician, and what an impact impact that has on the state's bottom line, because we know the devastating costs of diabetes to the state of Ohio and to the globe. And we know we have a return on investment on average $6 of every dollar invested. We are making a difference. Yes, we know you can make a difference. The commission has been fully vested in community health workers. Day one, because the commission has always known if we don't connect to the community, we don't have any business serving. It's the community connections that are going to make the difference. We know that the value that you provide to this state is immeasurable, because at the state level, you have to speak. Oh, I have to talk louder. Really? So sorry. Okay, I keep forgetting. I'm supposed to make sure. Hey, y'all, just when you know I miss y'all, give me a hug. All right. We know that we can calculate your value. We want the cost savings that you bring to translate into higher pay. We needed to translate into a meaningful, livable wage. We don't want to lose you. We don't want to lose you to marketing careers. So I'm saying stay. Work with us as we work with you, so that we can allow this to be the career ladder it is intended to be. What we cannot quite measure, and in some sense, it doesn't need to be. What we can measure is the power of your impact in the lives of those you serve. When someone who didn't think they were smart enough to get a degree and you assisted them, and then the residual impact on their children who saw them get the degree after failure, and the impact of that having a trajectory for their future graduate, we can't even measure that you allow somebody to grasp the opportunity for health again in their lives after they have suffered for so long trying to manage a chronic disease that has been embedded in the generations of their families, after they have watched them going to homegoing services, dying from the same diseases. So they thought they just had to take a number and wait in line. You have made a difference in helping people manage their chronic diseases, gain success in establishing a better health status for themselves. You've given them access to a home. Let's just pause. You have settled individuals in a home when they had been couch surfing, sleeping with whoever would allow them just a space on a couch or a floor. And you gave them that level of hope that you can't even measure what that does to a person's, how that stabilizes them for the future, how they build confidence on that, how they can hope again. When we talk about the work we do with those who are hopeless, and you replace that with a modicum of hope, that's immeasurable, but it's what you live for. It is that emotional value that I wouldn't even want to put some type of statistical analysis against, because you cannot measure heart. You can't measure care and concern. And yes, you absolutely are essential. And essential means an essential wage. Essential means that you are going to be acknowledged and recognized for all that you do. We want you to advocate. This is tough. I am a licensed counselor by profession. I'm a leader by choice. It is very difficult for individuals who care deeply and serve others to stop and have the ability to then make efforts to serve themselves. We struggle with it. Oh no, I'm fine. Let me just help her. No, don't worry about me. Sound familiar? You go ahead and pay attention to them. But there's a reason when we are on a plane, when turbulence in life hits and the oxygen mask drops, the instructions say, help yourself before helping others. Because we want you to be able to breathe. And we want you to be safe. And more often than not, the things you deal with hit so close to home because you know it could have been you. You know, you have lived these experiences, and some of you have been close to what you are now solving. But I want you to intentionally and strategically set aside time to advocate for yourself. This is a great day. We are here to advocate, but I want you to understand advocacy, as Miss Carrie Baker will tell you, is 24/7, 365. We do not wake up and say, oh, let's go intervene. No, these are strategic, intentional plans. And I want you to build your stakeholders in your community. I want you to recognize that there are stakeholders. You are a stakeholder because you're a community health worker. The people you serve are your stakeholders. The family members of the people you serve are your stakeholders. Your city council, your county commissioners, your state rep, and your House of Representatives, the U.S. House of Representatives are your stakeholders. Hospital systems are your stakeholders. FQHCs, stakeholders. Prison systems, stakeholders. Departments of health, stakeholders, state and local, city and county. Those are your stakeholders. And you have to approach them to say, what is it that we can do for each other? I've been working on your behalf. How are you doing? I've been making a difference in the work you do. How are you doing? We have to form champions and allies. And let me tell you, I don't care why people come to the table. I don't get caught up. I don't want people to be like me. I get sick of me. Okay? I want people to come to the table for whatever reason. Some people come because it's the right thing to do. Some people come because, oh, it's the passion of which we serve. And some people come because it's the economic thing to do. And some people come because they didn't know what you did anyway. And some people just come. Do not require people to speak your language Believe what you believe. Do what you do in order to help you. We need to be able to be in a room at a table. There shouldn't be a city council meeting in your city that some community health worker is not assigned. There should be community health workers assigned to every policy initiative in every city you come from. The planning, every city has a planning council, a regional planning council. Every city has county and city commissions. Every city has a school board, every city. And you need to be present. The policies that are moving to health in schools, what is the role for community health workers? The policies that are looking at re-entry, what is the role for community health workers? The policies that are trying to reduce emergency room use and avoidable second readmission, where is the role of community health workers? The healthcare systems and the hospital systems who are discharging individuals, what is the role of community health workers? I'm so glad you asked. Well, let me tell you, community health workers are the ones that make the difference. They are those connectors to what we call those sure services. I know. We have to call it evidence-based care. But you call it sure services because you're sure when you refer them to that colleague that you know they're going to pick up. You're sure it's going to make a difference. They're sure services. When you come up here, you call them evidence-based services. Because here's what we have to recognize. Every one of your stakeholders have different interests. And let me help you. The way I speak to you is not the way I speak to legislators. I stand there and say, okay, let the spirit of Dr. Let me be able to talk about the return on investment and the bottom line and the differences that we make. And the fact that in 2012, Medicaid had spent $313 million of their delivery care budget on a 14% return birth rate. And this is unacceptable. And therefore we must make a difference and we must invest in the hubs. And we started with 3 and now we have 12. Across the state of Ohio. Give yourselves a hand. But I want you to be mindful that when you are engaging with a population, tend to their language. So if you came upon an individual that you did not speak English, you would automatically, as a community health worker, if you didn't speak their primary language, you would engage with an interpreter. Okay, good. You are in a place that needs interpretation. You need to be aware that when we say we want you to be culturally and linguistically competent, you need to understand you have to be culturally and linguistically competent when you are engaging with legislators and policymakers. And while many of them will want your story of how it made a difference, they are the fiduciary agents of this state. So their first language is return on investment. That is not a bad thing. It is the language they speak. So if you speak to them in a language they don't understand, don't be upset when you walk away confused. You have to talk about what matters to the audience you are in front of. So we can talk about the return on investment that we make, and that for every dollar you invest is a $6 return on investment. We can talk about the hubs that had a 50% reduction and special nursery care. And we know that neonatal ICU costs will down. We know there is a per member per month cost savings for medium, high, and low risk individuals who go through a hub who are on Medicaid. Did you care to hear a personal story, sir, ma'am? But be mindful that you are engaging with individuals who speak a different language. And you have to be mindful of how it is best to communicate. I want you fully able and capable of doing advocacy work. I want you to have the same proficiency you have when you are engaging and reaching out and connecting individuals to needed and necessary services. I want you to have that level of proficiency. I want in my mind's eye, I can see city council meetings, regional planning councils, county commissioners, board of education. I can see you there. If you do not speak, let me say it as my grandmother would, a closed mouth doesn't get fed. A closed mouth doesn't get fed. And if we don't say it, I have never seen an allocation for other. I just haven't seen it. You know, we have to do this, 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 and other. Other never makes it in the budget. I need you to put a face on what you are doing and the difference you are making. And then next year, when you come, you're going to bring checks made out to the state of Ohio that demonstrate your return on investment. And you'll have a cancer check, and you'll have a diabetes check, you'll have an infant mortality check. Yes, you'll have a reentry check, you'll have a school check, you'll have an education check, and you'll, depending upon that committee member you're meeting with, hi, ma'am and sir, you're with the education committee, just a second. This is the return on investment because you are making an investment in us, and ask for what you need. They need to hear from you how you are struggling to stay a community health worker. You want to stay, you want to do this work, but the rent has gone up. You want to do this work, but you're taking care of so-and-so's kids. You want to do this work, but you want to be able to be on a career path, but you can't afford to go back to school. You want to be certified, but the training opportunities are varied and it really doesn't accommodate your schedule, but you want to do this work. And then you say, now be ready for this. When someone asks you, what is it that you would want me to do? You're not ready for that. You came up here thinking, oh, we got to tell them who we are and what we are and how we make a difference. Somebody today is going to say to you, what is it that I can do? And you need to have a ready answer. You need to be ready to answer that question in a very real way that is measurable so they know if they made it or not. You know how when you open the pathway and you got these metrics, you know about it, and you said, oh, in order to close that successfully, I must do click, 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 right? You want to be able to say to a policymaker, to a legislator, hi, this is what I would like for you to do. We need a livable wage. And they go, okay, what would you like me to do? I would like you to introduce legislation. You have to have a step-by-step. Here's what I would like you to do. We would like to meet with members of your committee and talk about this specifically. We would like you to meet with the Hub Network who lobbies on our behalf. We would like you to meet with the Community Health Worker Network. Why? Because we know that many of the individuals that employ you, they know that they are relying on grants. Many of you may work for a healthcare system, many of you work for the hubs, many of you work in hospital settings, but you have to be able to talk about what needs to be done. And then you have to be able to cite the information. You have to have those bullet points that are going to help you to say, sir, madam, one of the areas that we work in is diabetes. And so we work with emergency room systems to deal with individuals who have diabetes, to connect them to primary care physicians so that they have a reduced cost in their entry into healthcare access. But the other thing that we know that you may not know that I would really like to share with you, that for every 1% that the A1C improves, oh, I don't know if you realize this, but there is a 21% improvement in what? Chronic disease. Or for every 1% that person improves, there is improvement in the liability and the possibilities of stroke and other cardiometabolic diseases. Just want you to know, for every 1%. And you say, Miss Angie, why do you use diabetes all the time when you talk to legislators? Why wouldn't you just use infant mortality every time? There's a little secret you may not know. The majority of legislators are male. The majority of legislators are over 50. The majority of legislators have family members older than them that are likely dealing with a chronic disease such as, I'm just trying to speak languages that they understand. See, if I've already graduated my children from college, grandchildren may be the closest thing that I have to an infant. But if you talk to me about diabetes and neuropathy, I know what that feels like on my feet. If I talk to you about heart disease and recovering from heart disease and making sure that you don't go back into the hospital, I may be able to relate to that. But again, we have to have relatable subjects so that we can say, here is the difference community health workers make in the bottom line, and then talk to them about something that impacts their health specifically. We know this can be done. How many of you are aware of the Health Policy Institute of Ohio Health Value Dashboard? Raise your hand. Look around the room. The Health Value Dashboard is a policy document that you need to be aware of, because the Health Policy Institute of Ohio has really made inroads with the General Assembly to help them to understand what social determinants of health are, to help them to understand Ohio's health value. Ohio ranks 44 in health value out of 50 states. Yes, Ohio. So when you are talking with legislators, you need to talk about Ohio's health value and how you are making a difference in improving Ohio's health value. So when we talk about health value, we mean population health and healthcare spending, how much we spend and how well population health is ranking. We rank 44 out of 50 with these stellar healthcare institutions in our state out of 50. This is something they are going to know. They need to know that you work in the areas of what we call modifiable factors. You work with individuals and you work in the areas of the social and physical environment. You work where change can happen. When they say, what do? I work where change happens. And how do you do this? By linking individuals to services that will improve their health outcome. Isn't that what you do? And what difference does that make? It saves the state money. You have to be able to speak that language, especially when you are talking about advocacy. A community health worker is the infrastructure in a community to coordinate care for any community member who is at risk. High-risk mothers, I can coordinate care. Diabetes, I can coordinate care. Stroke, I can coordinate care. Heart disease, I can coordinate care. Cancer, I can coordinate care. Mental health issues, I can coordinate care. Opioid issues, I can coordinate care. Yes, you're the infrastructure. You're that connection to the community. Know your worth. You've got to know your worth because what you do makes a difference. How many of you have seen the 2018 Community Health Worker Assessment for the state of Ohio? Raise your hand, look around the room. Look around the room. I see 5 hands. The Ohio Department of Health, okay, and the Government Resource Center made an investment to do an assessment of what was going on for community health workers. This is a document you would reference in your meetings. When you say the Ohio Department of Health report on community health workers is no different than when Dr. Vanderhoff said, whereas. See, I had these whereases memorized. So I could say Governor DeWine recognizes that we are frontline public health workers, sir, ma'am. Governor DeWine recognizes the impact we make. According to the Ohio Department of Health Community Health Worker Survey, you should be able to rattle off, this is what we do for the state of Ohio. We are a bridge to the community. Some may call us community health workers, we may be navigators, we may be a home visitor. We are called many things, but all of us, regardless of our title, make a difference. Then you would be able to say 90% of the work we do connects individuals to care. So these are the reports that you want to be able to reference. Oh, so what do you, I'm so sorry, ma'am. Could you tell me the conditions that you address? Oh, certainly, ma'am and sir. We address mental health issues, we address diabetes, we address cancer, cardiovascular disease, and stroke. You may have some family members and you know the difficulty when they are dealing with chronic diseases such as asthma or high-risk pregnancy or even obesity, because I know you already know the cost of obesity in Ohio, ma'am and sir. The language you speak makes a difference. You already know you're effective. You already know you're making a difference. Now I want you to tell others in their language why they need to invest more in you. So when we look at what the future of community health workers look like, We want you to be able to have a say in that through your advocacy work. We know that you make a difference in making social determinants of health something that is an issue, but you are able to connect people to resources. You don't get to wave a magic wand and make transportation issues go away. But you know how to navigate to get people to where they need to go. You know the on the ground barriers. Who do you say you are? Describe yourself. Give me some adjectives to complete this sentence. As a community health worker, I am, give me an adjective.
Resourceful.
Resourceful. And just so you know, I have a significant hearing impairment, so use your playground voice. So resourceful. Community health workers are
Essential.
essential. Community health workers are resilient. Community health workers are
Support.
I know, I love that. Community health workers are
Knowledgeable.
excellent. Community health workers are, community health workers are, community health workers are,
Hero.
community health workers are.
Persistent.
I know what they say about you. What do you say about yourself? What do you say about yourself? I want that ringing. I want those adjectives ringing in your ear. So when you walk in the office, you walk in with the knowledge of that is who you are. And oh my goodness, aren't you honored to meet me, ma'am, sir? You have to walk in who you are. You have to walk as though you know the contributions you make. You can tell when someone walks if they have confidence. They walk. I want you to own every room you occupy today. I want you to own it. And I want you to go in with the knowledge that you absolutely are making a difference. You need to understand your power. You need to understand that you have the ability to consult with a primary care physician team, with nurses. You have the ability to engage. You have the ability to do outreach and engagement. You have the ability to do coordinated care. You have the ability to connect the most difficult individuals that they have ever experienced, and you have the audacity to have success with them. These are the people, when they go in the ER, they go, oh God, they're bad. You deal with those individuals. Treat them with a level of respect they deserve. Lift up their bowed down head and connect them to the resources that they need. You advocate for those services because you know enough about the healthcare system to know what they ought to be receiving, and you can tell when it's not happening. You link the client to the community. They may hand the list, but you do the link. This is who I say you are. Who do you say you are? It is not our darkness that scares us. It is not that dark place that all of us can get to. That is not our deepest fear. No, baby. It is your light that is your deepest fear. Because somewhere you are afraid to shine. And you don't do the world any service in hiding that light. So what I'm saying to you is your voice matters. Your voice matters. Your vote matters. Your service matters, and your light matters. You go forth and do what you have always done. I'm simply here grateful that you let me come for the journey. You have a great day.